But you don't have to start talking. But try to speak up, you know. And,
Was it too low last time?
no, actually, it was good. The sound was good.
Okay, all right.
This seems like to be a little closer, and since people aren't here, I can move it closer, right?
Yeah.
We wanted it to be head on. So you can start.
I can. Okay. All right, everybody. Well, you know, thanks for coming. A nice, cozy group of acquaintances. Some people I don't know, and that's all great. I want to do this talks on the theory of everything to see people's reactions and go through it myself and just see where it goes. You know, you've imagined my situation. You know, of course I do it with acquaintances because you know, how crazy is it? You know, where's Socrates? Where's Aristotle? Where's Spinoza? You know, who comes up with the theory of everything? Either I'm crazy, or maybe I've got some piece of a facsimile of a workable explanation of the theory of everything. So I state in the book, and I stated in my first talk, that Wittgenstein said that it's impossible to come up with a theory of everything. Marcelo Gleiser said the same thing. Berliner said the same thing. And they said, Gleiser said, unless there's a new theory or a new approach. And so my new theory is that it starts with health, the theory of everything, the explanation for the secret, the reason, the purpose, the meaning, and methodology of existence focuses around health and the optimum function, the optimum experience of your life. How do you do it best? How do you reduce risk? How do you maximize health and thriving? How do you maximize the best experience? And I said in my first talk that, you know, I think that rule number one is that you have to realize that you are never going to get everything material that you want out of your life, out of existence. But if you accept that, and you accept that your material reward comes from you raising other people's quality of life as best as your abilities allow, that if you agree to that, then what holistically follows, if you understand how to make health linear and predictable, that holistic result is going to more than please you, and you won't worry about any materialist shortcomings. I also think that, and some of you have been to my talks on chiropractic, I also think that it is impossible to find the theory of everything without being a chiropractor. Because I don't think it's possible to make health and thriving linear and predictable without chiropractic. And how am I explaining chiropractic, defining it? The body in its toto, in its structure, especially the spine, is like a musical instrument that needs to be perfectly tuned. Because the research shows that if any joint is misaligned, the aging of that joint accelerates 2 to 3 times faster than normal. And that just happens to fit nicely into the research of 5 studies that I know of, 1 mathematics study and 4 genetics studies, that show that, close that door, that show that human lifespan is 150 years. 100 to 150 years. And the researchers say, at least in 2 studies, they said we can't understand why we're only getting halfway. Well, that piece on the crooked joint would explain it by itself. If you have a crooked joint, it's going to age 2 to 3 times faster than normal. And Windsor said that when he opened up those 50 cadavers, he said that those wrinkled joints, those misaligned pieces, seem to precede old age and to cause it. So I think that the cause of disease is stress, and I'm saying that the cause of all human problems is stress. And so stresses, chemical, physical, psychological, and I would add 2 more, functional, and also what is the direction of your life. Those 5 things determine stress in your existence. If stress comes in and impacts your body and pounds your body enough, what they do is they cause a functional distortion. And if that functional distortion crosses a red line, that leads to a physical structural distortion in the tuning of the musical instrument. Now you have an endogenous stress in the body. And endogenous stresses, the research tells us, they are 10 times more powerful than exogenous stresses outside of the body. So, once again, I think that the accumulation of stresses, not to say anything about hormetic effect yet, the accumulation of stresses, psychological, chemical, physical, functional, and direction of your life. Are you living the ideal life of a human being? If those stresses overwhelm you, it will lead to a functional maladaptation of the tuning of the instrument. Somewhere you will have a crookedness in the spine, and that crookedness will stay there until it is physically realigned, because physicality is part of the entirety of the human spectrum. So it must be addressed. It can't be just addressed chemically and psychologically. You have to have that too, by correcting the nutritional or chemical errors, stresses that led to your problem, by unraveling whatever other stresses led to the breaking of the camel's back, so to speak. And one of those is structural. And so the structural must be addressed too. And the only thing in the world that does that would be physical therapy in a very, very superficial, ineffective way. Osteopathy and chiropractic. It may be that structural component, because it may be the last thing to go. It may be the red flag that, as I said, breaks the camel's back. Boom! Now that bone is out of place. It may be that is sort of like the rudder of the boat. So now that piece of you, this boat, this entity that's part of you that is now crooked, that is now out of place, that is now dysfunctional, that is now aging 2 to 3 times faster than normal. It may be that last component to go, the structural component, you have to address that in order to address everything 100%, holistically, thoroughly. But, if it came from bad diet, you have to address that too. If it came from bad exercise or lack of exercise, you have to address that too. So, and as a chiropractor, and when you learn about the history of chiropractic, one thing becomes very, very clear. One is the extraordinary power of chiropractic to cure problems and get rid of pain. And that's ordinary chiropractic, because CBP chiropractic, which actually gets into, because ordinary chiropractic does not correct the shape of the spine. It can improve it, but it will not correct it. The closest thing, the research shows, that can do that is CBP chiropractic. And when I graduated from chiropractic school, on our first week in school, I remember in philosophy class, they told us that as a chiropractor, you're going to find that you're going to be able to cure 80% of the problems that come into you. 10% won't get any better, and 10% will get worse. And I have to say, you know, after decades of practicing chiropractic, damned if the professor who told us that wasn't speaking the truth. It did seem to be the case. I would say that those cases that chiropractic didn't seem to work on, most of the time it was because the person didn't give it enough time. But also, you know, arthritis builds up because that joint is out of place. Arthritis is aging. It's aging 2 to 3 times faster than normal. Arthritis sort of puts a door jamb on the door. So once the door has swung open into misalignment, arthritis is putting a door jamb on the door so it can't come back. And that's where the physical pressures of CBP to gently unwind that arthritis gives you some chance of moving it back. But as I was saying, so the extraordinary ability of chiropractic to heal and the extraordinary ability of chiropractic to cure pain. And if you look at public health care and hospital costs, national health care costs, it is high resource patients, HRPs, that are the biggest consumers by far of healthcare resources. Whether you're talking about socialized medicine or privatized medicine, it makes no difference. And what are HRPs? By far and away, they are people with arthritis. They are people with physical pain. People who are going to get foot operations, knee operations, shoulder operations, back operations. And so chiropractic goes through that stuff, even, you know, superficial chiropractic, what I call ordinary chiropractic, not any of the specialty techniques in chiropractic. Even ordinary chiropractic does extraordinary work with HRPs. In the old days, before insulin was discovered in 1922, chiropractic also cured diabetes type 1, and a couple of studies have verified that. CBP has a study from 3 years back on chiropractic curing diabetes type 1. I would give a patient's adjustment, and I'd say, watch out for your insulin levels, watch out for your blood sugar levels. And they would come back and say, it's extraordinary. And the first adjustment lasts 4 days, the second adjustment would last 2 weeks, the third adjustment lasted a month, the adjustment after that lasted 6 weeks, and then the guy I'm thinking about, he quit care and went back to, you know, taking drugs and sticking a needle in his arm every day, or whatever medicine has, you know, for you to do that. Chiropractic will do nothing about diabetes type 2, but Fong, MD, he has found that intermittent fasting does tremendous work for diabetes type 2. So there we have it. Diabetes, a huge killer and crippler, with 2 holistic methodologies, chiropractic and intermittent fasting and a plant-based diet, reducing calories, increasing the percentage of vegetables, fruits, and antioxidants in your diet, seems to take care of the entire category of diabetes. Chiropractic had 2 mental clinics, 2 mental asylums, Oak Ridge and Clearview Sanatorium. And they did tremendous work, and they were open until the 1960s, and then in the 1960s we had the medical industrial complex and the government get on one another's side and push for insurance, pushed for everybody to get insurance, and of course, insurance, private insurance, would not take care of any holistic methodologies. It was only medical methodologies. And so what happened to Clearview Sanatorium and Oak Ridge Sanatorium? They both collapsed because they withered on the vine. People no longer had enough money to go in there to pay for the private care. They went for a place that had private insurance. What else? Oh, the infectious diseases. If you look at, if you're a chiropractor, you must get involved with the Association for Chiropractic History. And you must read all of the volumes, especially the ones in the old days where we hear of the spectacular chiropractors and their spectacular results from the old days, from 1895 until the 1930s, when chiropractic really lost steam. You get to see what chiropractors were using chiropractic on everything, because medicine had no answers. Medicine only had one tool, basically aspirin after 1900 and various opiums, laudanum. If we look at the 1860s and the birth of the pharmacological industry, when did it begin? In the 1860s, with the mass production of opium and opiate derivatives, and that was the major painkiller. There were some other things too, and then in the late 1800s, their biggest seller then became cocaine. And the people who did the best were the German pharmaceutical companies with their affinities for laboratory grade this and that. And they were the gold standard for the pharmacological industry in the world. And then in the 1930s, they discovered methamphetamine. So basically, the pharma industry begins with drug pushing. And they have higher sales the more we are addicts of what they have to sell. It's not a very holistic and auspicious beginning, and it's not outside of the realm of fairness to say that it stays that way today. So chiropractic did tremendous good, and it's all over the place. And Solomon Langworthy, one of D.D. Palmer's great students, he set up practice in Iowa, and one of his first cases, and everyone who came to see him, he insisted that they sign a affidavit that said that they weren't doing anything but chiropractic because he didn't want anyone else to try and steal the credit of chiropractic, and what their results were. One was a case of paralytic polio, I think in around 1907, and maybe 1908. So he adjusted this guy. He left. He felt sick and walked home. And by the time he got home, he could barely get into bed. He got into bed, and now he's paralyzed and he can't move. And so all numbers of doctors come to the house with his wife and his mother, and they look at him and they say it's polio and there's nothing we can do. And they see the ad for Dr. Langworthy, and they call Dr. Langworthy in. Dr. Langworthy comes in and he says, yes, you've got polio, I will do chiropractic, I think I will help. But if you want to be my patient, I want you to sign this affidavit. And what it says is that no one else will treat you. I don't think that's hard because no one else can. And you just tell on the affidavit what your results are. Do you agree? Yes, I agree. So they signed the paper, and he gave the guy his first adjustment. He said 3 hours later, virtually all of his pain was gone, and he started to feel his legs. Every day, Langworthy came in and gave him an adjustment. House calls, very common in those days, of course. I think it was within about 6 days, his pain was gone, and he was able to walk and move around the house. And at some time later, he returned to work, completely normal. The guy signed the affidavit, and Langworthy put it in the papers because in those days, the papers would print stories that were inauspicious to medicine because, well, it was the Wild West and they wanted a good story. And if it seemed to be true and you had an affidavit, well, why wouldn't you publish it? Well, who cares that, medicine doesn't like it, because back then, they weren't, 1/4 of the American economy, and nobody has more media buys and advertising buys than they do. And so they can carrot and stick you today, but in those days they could not. And probably most Americans would have said, I'll be damned if I'm not publishing this story. A lot of papers would have said, I'm gonna stick with the medical line. I've been socialized to believe mainstream medicine. I'm not gonna rock the boat. But in those days, the newspapers were full of what we called chiropractic miracle cure stories. I think that term comes from Dr. Christopher Kemp. So the point of this story is that these MDs, waves of MDs come in because they've read the story and they see Langworthy doing his chiropractic and they say to him, "What did you do, doctor? How did you cure this patient?" And Langworthy said, "Well, I used chiropractic." And the explanation is as such. When bones are out of the place, they pinch on nerves, they irritate the spinal column that's affecting the nervous system. We could have problems with this. So we adjust these bones, we improve their alignment, we improve the body's tuning. It seems to improve neurology, and well, look for yourself, see what happens. So to a man, the MDs heard these stories, kind of blinked and blinked again, walked out, and nothing was done. There was a man, I think he was from the UK, and his name was Campbell, and he published an extensive textbook. He was an MD, and the medical applications for osteopathic, chiropractic, physical medicine work. And he said, the results are spectacular. He said, it doesn't work on everything. I'm not sure if that's true. But he begged his medical colleagues to understand and appreciate and open their mind to how big a category, how big a silo structural health is. And Campbell said in his book, he said, part of the problem is that most MDs, they want a chemical solution, they want a complicated solution, and they don't want to hear about simple cures because, I can't remember if he actually said this, but it makes them look bad. It makes them look foolish. I mean, if you're coming in here with this Rube Goldberg apparatus, right, and it costs $1 million, and Solon Langworthy comes in and you can't do anything about polio in 1908, no matter how big your Rube Goldberg apparatus is, and he does a chiropractic adjustment and, bang, your polio is gone, you're looking foolish. And how many years and how much education and how much social favorable bias is aligned up, behind you as wind in your sails. And all of that socially has to be undone, sociologically has to be undone, because in our social box, the MD, complicated medical procedures, unexplainable complexity is the rule of the game. And holism, by its very definition and nature, goes to simple cures, diet, exercise, I'm adding structure, psychology, and it does tremendous things with those things, with the basics, the holistic basics. So as a chiropractor, you read about this and you see from the medical industrial complex, before it really became the early days of the medical industrial complex, really it started becoming the medical industrial complex in the 1920s. But you can see chiropractic on the sidelines, the redheaded stepchild of medicine and science saying, look at me, look what I'm doing, look at this, look at this. And there were MDs that took interest, and they got the carrot and the stick. So you get from MDs and you get from the scientific community almost a boxing out, if you will, of chiropractic. No matter what the potential cost to the human race could be in ongoing sickness and ongoing pain and ongoing costs, as if Campbell, writing in 1915, is exactly true, that it's almost a state of mind, it's almost a sociological hypnosis, that we want things to remain as complicated as possible because maybe we would feel foolish, maybe it would be so doggone defeatist for us if we saw how far afield we were in how we conceptualized and treated disease and problems. So, as a chiropractor, Dick Holtz, he had done a chiropractic study where 1 or 2 atlas adjustments with upper cervical technique, and this was a study that came out like, 15 years ago, with the #1 cardiologist or blood pressure specialist in the world, so it got a lot of attention for like a month, and now it's been forgotten. But Dick Holtz, whom I talked with innumerable times on the phone, great gentleman, 2 adjustments or 1 on the atlas, and it was as effective in lowering blood pressure as 5 hypertension medications. One study, and you can find, it just goes on and on, the International Chiropractors Association webpage has a beautiful review of chiropractic studies. Chiropractic.chiro.org has a beautiful webpage of, I think they've got 150 references, studies, papers, government studies, government reports, all saying chiropractic works, it works splendidly. We absolutely have to have it in our health care and in our workers' compensation package because we're getting blown to bits by costs and poor results. And yet, nothing changes. One of those studies on the ICA page showed that 20 minutes after a chiropractic adjustment, killer T cells, their activity is up 27%. I can't remember he was a professor of mine at school. He's a specialist in upper cervical care. They did a study of AIDS patients, and they found in 6 months, AIDS patients with upper cervical, their immune systems were up 49%, compared with controls whose immune systems were down 8%, and 3 of those patients had died, and so the study was supposed to last for a year, and so when they saw the International Doctors Organization that funded this study, saw the results, the study was supposed to continue for a year. They closed it down after 6 months and did not fund it anymore, and nothing further went on with chiropractic and people with full-blown HIV/AIDS. So I tell my patients, if I could take and raise the immune system function of the world 27% and up to 49% in 6 months, how much could I change the world? How much could I blow away what the medical industrial complex has to offer? So when you see that chiropractic is not getting any traction, and these same voices, these same interests, these same institutions and leaders and experts, whose expert is human health, public health, the ascension of the human race, healthcare costs, when you see them not stepping forward and opening the way up so that chiropractic at least gets some bigger studies and at least gets some serious input from public research dollars. I mean, after all, those are public dollars. Who's controlling those? Shouldn't some go for chiropractic? As far as I know, I think NIH started having a chiropractic department in the Clinton administration, and every year since then, I don't know that they've really done anything. They keep looking at chiropractic and back pain rather than chiropractic and immunity, chiropractic and diabetes type 1. Havik gave one chiropractic adjustment to patients with chronic stroke, and we were all expecting like, maybe 5% improvement. I think it was a 67% improvement from one chiropractic adjustment with chronic stroke. Why not a study like that? Somebody seems to be stepping on the neck of this baby. So my point is that I don't think that you can approach the theory of everything and realize that it begins with health and thriving and our optimal life experience without the chiropractic component. Because you see that institutions and civilization, or at least part of institutions and civilization, are willing to block out breakthroughs that would absolutely change the human conversation on well-being. And I understand that, we're in the social box and chiropractic is like, it's a bridge too far. Chiropractic is not only regular chiropractic is a bridge too far, but CBP chiropractic is two bridges too far. And I mentioned the CBP because, I would have these difficult cases when I was using ordinary chiropractic in the old days. From 1980 until I heard about CBP in 2002, I believe it was. And a colleague told me about it. And so I started bringing CBP chiropractic into my office so that, people with, these bad postures like this, now I realized, oh my God, this is, as Don Harrison said and Dee Harrison said, these are massive subluxations. This is a massive subluxation. If you're that crooked or like this, ordinary chiropractic can't do anything about that. You've got to stretch the bones, the ligaments, and the discs in order to make a more effective correction. Solon Langworthy talked about that in 1903. So when I started doing that, I started seeing, even better results than 80, 10, and 10. Now, still people quit. But I would say that it felt to me like I was on course to maybe do 95 and 2.5% don't get better and 2.5% get worse. I don't know. That's kind of instinctively what it felt like. But in a world with an open mind, we could have people who bring forth these observations in case studies and case series, and it would make an impact. But instead, institutions in chiropractic are saying that, the only thing that chiropractic can afford are case studies and case series. But, beyond chiropractic, lots of people are doing marvelous work, and that too does not get the attention or the traction. And I think it's because very, very smart people in the medical industrial complex have known about chiropractic for a very long time, and they saw it coming. And starting in the 1960s, they had an organized effort to discredit it and prejudice us against it. So, like calling it quackery and calling it dangerous. Nothing is safer than chiropractic. The insurance actuaries know. My insurance for malpractice insurance for chiropractic $1 million coverage was $750 a year. The safest specialties in medicine are pediatrics and dentistry, and they are about $15,000 to $18,000 a year. So if you think dentistry is safe, then, well, chiropractic is, what would that be? I'm not very good at math. 18 times better, safer than dentistry, for example. And then you've got, insurance that costs $500,000 and $1 million for the more dangerous specialties in medicine that no one says, oh, they're too dangerous, don't go to them. So part of this is our social box. We're raised in our social box, and we just don't equate spinal tuning to profound improvements in healthcare and the bottom line in national healthcare, whether it's socialized or privatized. But I think that the finger on the scale is something that needs to be addressed. And when you look at that, you see that there are public leaders who are willing to keep us sick and disinformationalize us and keep us in the dark and rob us of information in order so that they can maximize their business models. So they're blocking us from the basics that would do tremendous holistic good. Why? I like to say that the less you care about people, the less you care about human beings, the more you are a psychopath. So there's psychopaths, there's sociopaths, there's narcissists, there's selfish people, and somewhere on that scale. So those people who look at information and are willing to block the improvement of the human race the most, those are the most psychopathic people amongst us. And those who are moderately willing to do it, well, then they're sociopaths. And so when you look at psychopaths and sociopaths and why they're willing to abuse human beings, I find it fascinating that when you distill down the motivation of people who really do not care about other people, they do it for the same 4 reasons all the time, or any combination of those reasons. The 4 reasons are power, money, sex, and ego. The ego of a psychopath, a sociopath, a narcissist. Well, of course you should. You're better than they are. They're not your equal. You don't have to care about them. They're stupid. They're stupid enough to be fooled by you, and that's a self-enforcing feedback loop. So, and it's kind of ridiculous that, because, everybody wants power, sex, money, and the ego that, that they're a good person and that they're trying to help their society and help the human race. But the only time that it's holistic, the earning of that is holistic, is if you're doing holistic work to holistically better the human race. And I think that in order to define what is holistic for the human race, you have to get back to the theory of everything. What is the secret, the meaning, the purpose, the reason, the methodology of existence? Without that, then we can go all the time, and it becomes a postmodern argument which says there is no morality. Everything is relative. Moral relativism. What is good is what works for me. What is good is what works for my group. Well, that's what Stalin and the communists said. That's what Lenin and his communists said. That's what Mao Zedong and his communists said. That's what Hitler and the Nazis said. What's good for our party is best for the world. Just like, GM said, what's good for GM is good for America. So, we have to be careful with that because if you're knocking out the holistic struts on what works and what works cheaply and what works holistically and thoroughly to improve the human condition the most, if you're blocking that, then you don't care about people. And in my terminology, you're a psychopath, because the less you care about people and their holistic welfare and their holistic ascension towards what is better, you're getting in the way. So all of us want power, sex, money, and ego. But we're entitled to what we earn holistically, i.e. by improving the quality of life holistically of other people. If you push a broom and you're not doing any harm, you're doing good for the world. But how much is it raising other people's quality of life? Well, you're going to get paid commensurate with how much your society views the worth of pushing a broom. If you're making an iPhone, you're going to get paid commensurate with what your society views the worth of an iPhone is, commensurate with how much does it raise their quality of life. So what a psychopath is not happy with is how much they would earn holistically in power, money, sex, and ego. They want more. And so they will disinformationalize us and mislead us, compromise our information so that we can't become more holistic. We can't become more self-reliant or reliant on more holistic sources, therapies, methodologies, ideas. And they cheat us that way so that they can make obscene amounts of power, money, sex, and ego, because they're out of whack and they don't give a damn. So in looking at the theory of everything, I believe that when we look at the secret meaning, purpose, and reason for life, the methodology of life, it focuses down on health and thriving. It forms a shell around our optimal life experience. First you must survive, then you must thrive, and then you can have the best chance in the shortest amount of time discover what the secret meaning, reason, purpose, and methodology of your existence is. And the methodology of your existence focuses around you having the best holistic life experience you can. Because if you don't say holistic, you could say, well, hell, I'm going to take a whole bunch of drugs. I'm going to snort a whole bunch of cocaine. And I'm going to be a psychopath, and I'm going to abuse the hell out of people, and I'm going to enjoy it. You know, you could say that, right? Except the way the consequences and the risks of the universe works is, I like to say, the more people you abuse, and the more they're aware of it, and the more they awaken to that you have abused them holistically, that you've cheated their quality of life, that you've cheated them of their holistic best life experience, the more those people are going to be pissed off at you, and they're going to seek to undermine you, and my little cute phrase is, they're going to wait for you outside your hut. So, the way I look at existence and life is that all facts, all data, all results, all consequences, all information, if it is good information, it feeds back to show you how to live your best life. Data in medicine, we look at it, and how do we rank it in value and worth? Because it shows us how to live better. If it doesn't really show us how to live better, it doesn't really apply. It's not applicable. Now, of course, you can talk things about, the cosmos, so I'm talking about things in human scale. As soon as things refract into this envelope, this sphere of bounded instability and emergent self-order in human affairs, that event horizon brings them into focus around the ideal of how to live your best life, how to identify the function, the concepts, the methods, the ideas that lead to your best life experience. And I think that the same ideal, the same perfect, applies to society. Because when we enter into a society, we're a group of individuals, and now we have to compromise our individual desires and balance those with the interests of others and the interests of society. So it took me a long time to figure out the universal definition of innocence and guilt. And I think the universal definition of innocence and guilt is defined by your society, the interest of your society. If you are doing things that harm yourself or other members of society, or the function of that society to survive and do its best and improve itself, hopefully, let alone maintain itself, but hopefully improve itself. If you are interfering with that continuum, with that flow, that's the definition of guilt. We don't want people to commit suicide. We don't want people harming themselves. It disturbs sight. It disturbs us. It disturbs the family. Why is a person so stressed out? They're so wounded in so many different ways by stress that their brain is so sick that it has switched around to overcome the survival reflex. That is an incredible amount of stress. And we don't like it. It's disturbing. So, and we don't like disturbances to the goals of our society. And as we come up from the muck through the fermentation field, when the Goldilocks zone happens and the 6 elements of life come within range of photons and start kicking into the evolution of living forms, as we come up through that, the world is a very big place, and there's many different tribes, and they conflict with each other, and they fight each other, oftentimes to steal what the other group has. And then we start farming, because, we have this advantage, a wildebeest can't grow its own grass, right? A cheetah can't grow its own gazelles. But a creature that evolves to a certain level of sophistication can grow its own grass. So now other tribes, they may be able to grow their own grass too, or they'll steal your grass. It works, It's a nice, easy thing. Go there and kill them and take their stuff. But look what happens. There's risks. Some of you might get killed. And so Bennett in 1803 pointed out the sea change that happened when human beings sophisticated enough that they realized that conflict was less advantageous than cooperation. So that's universal. You're born and you want to survive, and there's always strength in numbers. So the bigger the tribe, the better. And the more you follow cooperation over conflict, now risk is reducing. Life existence is becoming more linear and predictable. And now you've got this really thriving tribe, and it's better off to go out and still attack these other tribes. So as long as there's tribalism, it makes sense to, keep on beating the hell out of each other. But what if, we're supposed to be one tribe for the maximum of strength in numbers and the maximum of cooperation over conflict, so that our society is, our tribe, our society, our group is positioned best for whatever improvements come next. It just makes innate sense. And, again, I love to quote Leibniz, and I hear Spinoza said the same thing. Why is there something rather than nothing? Why do we have this hierarchy of moral realizations inside of us that makes sense to all of us, that uniformly reduce risk and increase the chances of success? I think that, I call it the operating system of life and existence, and I think it's perfect. And it says that, my interpretation of what it says is that the human race, all human tribes, are on a course of evolution to get sophisticated enough to realize that we are at our best. We achieve survival, health, thriving, strength in numbers, cooperation over conflict. And then somewhere along the journey, we wake up and we realize that we are best as one tribe composed of many charming sub-tribes. And still the value of strength in numbers, cooperation over conflict, for whatever happens next, continues to make perfect sense. And down goes risk, down goes chance, except for accident. So I think that the operating system of life and existence is pointing us towards this little credo, or this long sentence. First do no harm. First do no holistic harm to anyone, even to any other tribe, for the reasons we just outlined. So let's imagine that we could be one big tribe composed of many charming sub-tribes. And then the same laws that apply to the big tribe apply to all the other tribes on their comeuppance, which is harm to none, thriving for all, in order to create the optimal platform for genius and creativity, creation, in order that we find the most satisfying, rewarding, safest, holistic, fun, joyful, the most interesting existence it is possible for us to even imagine, given that we're mortals and we have limitations of matter. We're not omniscient, we're not omnipotent. I think we are incapable of imagining a better existence than the ideal existence that is offered us every day, simply by a choice. The choice of, I'm not going to holistically harm anyone. And the more you disagree with that, the more you engage in that, the more you are a psychopath. And it's even more ridiculous because all you're after is more money, more sex, more power, more ego. We all want that, but you want more than you could holistically, rightfully, rationally, justly earn by engaging with the rest of us sane people in this holistic meritocracy, a populist meritocracy of genius, where what we value most is genius. You could say, once again, well, I'm going to snort a whole bunch of crack, and I'm going to take acid, and I'm going to imagine an existence better than the one Walls-Kaufman has described in his theory of everything. But even on acid and crack and cocaine and meth, take all the drugs you want. You're still not going to imagine a better goal than the one that is innately, intrinsically, inherently offered by the operating system of life and existence currently. And all of it just comes from realization and the value of that single choice. Even if you take the cocaine and the LSD and you're flying high and you're seeing stuff in colors, all you're doing is you're seeing, the universe in colors, but you are not envisioning an ethical structure, a moral structure that is superior to the one that I've just described, that is intrinsic everywhere we look. The consequence, the data, the facts, the results of everything we do, directly or indirectly, points to that middle ideal of first do no harm, harm to none, thriving for all, in order to make the optimal platform for genius and creation. It seems the ultimate realization of living things is to evolve to the level of advancement and sophistication where they suddenly click on the idea that the coolest thing I can do to spend my time after I've battened down survival and thriving, the coolest thing I can do is imitate creation itself and create. Create what? A higher holistic quality of life. Now we get into what's holistic. Because are plastics in the ocean holistic? Well, the thing is that when we look at psychopaths and their role in history, inevitably they seek to become our leaders. And inevitably they seek to harness, trim, control, tailor the human momentum, our movement towards greater understandings, better products, better services that raise our quality of life. They try and massage that so that they get the maximum return and that they're never at risk. They're never thrown into the crab pot with the rest of us in the meritocracy of genius, where your reward and your success is measured by how much you holistically raise human quality of life, at least for your tribe. And psychopathy tries to use genius in order to injure the genius machine, right? So they'll find weapons of genius, right? Like the gun. And what can you do with a gun? Well, you can go mess with that other tribe with a gun or a bayonet or a shield. But what are you doing? You're inhibiting. It's one part of the genius machine interfering with, undermining, sabotaging another part of the genius machine. So yes, it's ingenious, but it's a genius that's being used for infernal purposes. The gun's a good thing. You could hunt buffalo with it, blah, 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 blah. There's, you could keep another tribe that hasn't figured out life yet at bay. Hey, we'd love to have you join our community of man by joining us in the genius machine, but you clearly don't see that morality yet, and so we've got our guns on you and, don't bother us. We're happy to try and educate you and encourage you to see the existence of the meritocracy of genius, the populist meritocracy of genius. But, hands off us, don't interfere with us until you catch up. I call it the populist meritocracy of genius because just as we value nothing more than we value genius, one of the reasons we value genius more than anything else is because of its perfect unpredictability. And I can't emphasize this enough. Genius is perfectly unpredictable. You cannot tell who it's going to come from, what it's going to say, what it's going to lead to, what it's going to lead to next. what it's going to inspire. And that gives us all value. Because as I see it, when I read the operating system of life and existence, I think what it's telling us is that all of us have potential value. All of us have potential holistic value if we make the right choice to do no holistic harm. First, do no harm. Because if we do that, then everybody on the planet has the potential to be a genius or a helper of genius. And isn't that a good thing? I call it being trapped by the alternatives, or trapped by risk. That conclusion, that system, that function, that ideal offered every moment since time began by the operating system, by existence, by God, life, the cosmos, existence, the universe, creation, Godness, whatever we want to think that put us here and started us in motion. It's the perfect offer. So, Dr. David, what about, evil? What about psychopathy? What about misery and pain? All of our problems. Well, the cause of disease is stress. And stress has many, many different definitions. I think that the number one stress is like death of a child, death of your mother, death of your dad, death of a spouse. It's all death of people near and dear to us. And stresses 6 and 7s are I think, a promotion or a raise. So good things are stressful because they are change. Change is an important definition of stress. But ultimately, I'm going to define stress as this. Stress is a challenge to the way we are supposed to be. Stress is a challenge to this holistic ideal in all of us. If you deviate from it in the best way to eat, the best way to exercise, the best way to structure the body, tuning it like a musical instrument in chiropractic, ethically, because you do not understand, you violate the intrinsic ethics of any group or tribe or society as it's trying to maintain optimal function to survive, maintain itself, and move beyond maintenance. If you do not understand the secret, meaning, reason, purpose, and methodology of existence, if you're in the dark about that, that is stressful. Right? I mean, why am I here? Why am I something rather than part of a whole bunch of nothing? What is my function? Well, I think that whatever created us, creating the operating system, it's intrinsic in the operating system. To me, it's self-evident. Whatever created us said, well, I want them to learn how to achieve consistent health and consistent thriving. And then, because then I'm sitting in this chair, as I'm speaking to you, and I'm not moving, right? I'm sitting on my hands, and I'm not moving, So, Dr. David, what are you doing? I'm thriving. That's cool. What are you doing with it? Just enjoying it. That's cool. What are you going to do with it tomorrow? I'm just going to enjoy it. That's neat. Is there anything more? No, I don't think so. So you're just going to sit there? Yeah. So 10 years from now, or when you're 98, you'll still be sitting there? Yeah. But because we're mortal, because we have limitations of matter that we didn't decide upon ourselves. There's questions. And you know, we were born into this world naked, and then we put on a loincloth, and then we started making tools, and we discovered fire. And everything we've done since then, I mean, look how far we've come. All of it, every part of it, is genius, or somewhere on the continuum towards genius. Some of it's, that's a good idea, and some of it is outright genius. So, it seems like genius and our search for understanding and meaning takes us on an adventure. So we're not just sitting here. It's like whatever created us, plopped us down in a train and, didn't worry about our complaints about, damn, I got pain, damn, I'm hungry, damn, I've got stomach aches, damn, I've got cancer, damn, I have diabetes. It didn't worry about that. It knew that in time we were going to bump into answers and evolve along this path, and we were going to be taking a journey because it knew intrinsically that existence is so much more fun when you're on a journey than when you're sitting on your keister just enjoying your thriving. Why not enjoy your survival, your health, and thriving on this great journey of genius towards a higher quality of life in products, services, investments for products and services, and understanding. And the whole thing takes on this beautiful momentum, this gorgeous momentum that I defy you to think of a way that it can be made better. Again, you can take the drugs, which will amplify the colors of what you're watching, and maybe you'll see another dimension beyond this one. But I don't see how creatures in another dimension would get away from the same basics that the operating system presents to us, which is survival, strength in numbers, cooperation over conflict, in order to hop on the train of the greatest journey that can be imagined. And in fact, you cannot imagine anything better than it is. So we got started a little bit later tonight, but and I don't know how long we've gone, but I think this is a good place to quit. So, good night, everybody, and thanks for coming. Was it?
It was totally different from the first one.
Incredible. Incredible.
Was it totally different from the first one?
Totally different.